Hi, my name is Michelle. I'm one of the ortho coordinators here at UnaSource Surgery Center. We'd like to talk to you a little bit about coming in for your joint replacement here with us. I have Jim and Allison, who are part of our physical therapy team here at UnaSource. We're going to talk to you a little bit about what to expect when you go home. And I just want to mention too that before surgery, you're going to spend a little bit of time with myself or one of my colleagues on the telephone, going through your history, going through instructions, giving you a chance to ask questions. We also have other resources on our website for you. There's a 10-minute video that we'd like you to watch preparing for your joint replacement at UnaSource. There's also a booklet we'd like you to look through. There's a lot of great information there that you can find. At this point, I'm going to turn over to Jim and Allison and let them give you some great information to help you through this process.
Hi, my name is Allison. I am part of your physical therapy team here at UnaSource. I'm going to talk to you a little bit about the day of surgery and what you should expect from our staff. When you are in surgery, myself or a member of our physical therapy team will meet with your caregiver in the lobby. We'll give them a packet of information that outlines ways on how to keep you safe and ways that you can have the best recovery possible. Once you come out of surgery, myself, again, or a member of my team, will be present with your nursing staff so that we can help manage your postoperative pain. You will have some degree of postoperative pain, but it will feel better when you stand up. Once you're dressed, we'll stand and walk. We'll walk down the hallway, we'll walk to the bathroom, we'll practice transfers in the bathroom with your caregiver so that they know that you're safe at home. Then we will walk towards the stairs. You'll perform some stairs before we get you safely in the car. Once you're in the car, we'll make sure that your caregiver is confident with the instructions they've been given.
Hi, I'm Jim. I'm another member of the physical therapy team. I'm here to talk to you about your post-op recovery after you leave the surgery center. Our number one focus is to keep your pain level anywhere from a 0 to a 5 out of 10 during your recovery. What a 5 out of 10 pain means is it hurts, but you still want to get up and walk. Anything above a 5, you tend to want to lay in bed and just rely on the pain medicine, and we don't want it to get to that point. Most patients will experience an increased level of discomfort a day or two after surgery, which is when the nerve block will wear off. But the pain medicine that the nurses will talk to you more about will help control that pain and keep it down to a level of 0 to 5. The second way to help with the pain is icing it. 6 to 7 times a day for about 20 to 30 minutes at a time. What we don't want to do is apply that ice directly to the skin. We want to make sure you have a barrier of some sort, whether it's clothing or a towel or a pillowcase. And we also want to make sure that at least 3 of the times that you ice it, you elevate it. And what I mean by that, if you look at my finger, you got the knuckle as being your knee and my tip of my finger as your foot. We want to elevate your leg so that leg is nice and straight and the foot is above the level of the heart. At no point do we want you to rest with a pillow under your knee and a slight bend in your knee. We do not want to heal in this position. So we want to make sure that your leg is straight, it's elevated and straight, or you're moving it. The third way to help with the pain is movement, getting up and walking and doing the exercises. So the day you go home from surgery, we want you just to relax. Get something to eat, take a nap. If you have to get up and walk and go to the bathroom, or you're tired of sitting and you want to get up and move, absolutely you can do that. Just don't set yourself up on any schedule. We want you to rest. We want you to get this anesthesia out of your system and get feeling better. The second day, when that medicine's out of your system, we do want you to get up and walk every hour when you're awake. Don't worry about how far or how long you walk. We just want you to move. As you become tired or sore, take a break. We don't care what you did the hour before. We don't care what you do next hour. It's the consistency of getting up and moving that's going to promote healing and help with pain relief. A few things with that is, one, when you do get up and go for your every hour walk, stop at the bathroom. And you'll see the day of surgery, when you get up and move, it's a little bit slower process than you're used to when you're moving. And if that bathroom is far away, it's a race to get there and we don't want you to fall. So being proactive with it will help keep you safe. The second thing is you're gonna go home with this gait belt on. This is very important. So for the next 2 days, after surgery, so if your surgery's on a Monday through Wednesday, anytime you get up to walk, somebody's holding onto this belt. You have a caregiver that's capable enough to walk with you and keep you safe. The highest risk of falls are the first 48 hours. The reason we give you this is twofold. One is because of the nerve block. The nerve block can make that quad muscle weak, which is the muscle that keeps our legs straight when we're walking. So when we take a step, if that muscle doesn't turn on, that knee can buckle, and that would be because of that nerve block. So having somebody with you to make sure that you're safe is a great way to keep you from falling. Also, when that nerve block does wear off, like I talked about, and that pain does elevate, you're gonna be taking that oral pain medicine, which can sometimes make you a little lightheaded or dizzy. So having somebody with you to make sure you're safe is important. And lastly, you're gonna go home with this immobilizer on. This immobilizer is to be worn for anywhere from 1 to 4 days, really dependent on what your therapist says that comes out to the house. They wanna make sure that your leg is stable enough to hold yourself up without this on. This is because of the nerve block mainly. So when that nerve block is active, like I said, it can make that muscle weak. This is gonna offer you some extra stability to keep you safe. You're gonna wear this anytime you're walking until the therapist tells you you don't have to wear it. Anytime you're resting, laying in bed, sitting in a chair, couch, recliner, we take this off. This does nothing for you when you're resting. And we're gonna apply these, which are SCDs, sequential compression devices. And what these do, these help prevent blood clots. So you're gonna wear these anytime you're resting for 2 weeks around your calf, and we'll show you and your caregiver the day of surgery how to put these on. You're gonna have home physical therapy coming out to the house. Depending on what your surgeon orders, you're gonna receive between 1 and 5 visits of home care, and then you'll transition to outpatient physical therapy after that. It's really important to attend outpatient physical therapy because you wanna get your range of motion back. You have a window of approximately 4 to 8 weeks of getting that full range of motion back. So we really wanna make sure that you attend physical therapy and follow what your therapist tells you. And if you do all this, you'll be on the road to recovery.
Thanks for taking the time to watch this video. We hope you found this information useful. We'll see you soon here at UnaSource.